2,200 people today seriously ill in critical care units across our country. Our modelling also shows that today, on the 30th of April, if that trend had have continued, 4,800 people would have lost their lives from COVID-19. Sadly, very sadly, 1,190 lives have been lost to this virus, and we think of all of those families grieving at such a difficult time. But thanks to the incredible efforts of the Irish people, our modelling suggests that you, the Irish people, have now saved over 3,500 lives. That is 3,500 reasons to stay at home, 3,500 reasons to stay the course, and 3,500 reasons to keep with us on this journey. We have made significant progress, but we cannot let that progress mask the current reality. Up to 40 people a day are still being hospitalised with COVID-19. Between 3 to 4 people every day are being admitted to intensive care units, the sickest patients in our country. We must finish the job. If we want to give this country the very best chance of success, we must continue with the work. If we want to continue to save lives, we must stay united. We must stick together. I understand the fatigue that people are feeling at this stage. I really do. We all feel it. It's human nature. We're all human, and denying ourselves of many of the things that are most intrinsic to our very humanity. I know we all now know a lot more about the virus too, and about the ways we can protect ourselves from it. But we must guard against any sense of invincibility. Some people are more vulnerable to this virus. Yes, that's true. But everyone is vulnerable to this highly infectious disease. And maybe in the last couple of days we've heard maybe a growing commentary that it's only people of a certain age or only people with certain conditions. It's not. We're all vulnerable to this virus. So we must remain cautious and we must remain vigilant as individuals and together as a country. I know that people want us to map out what the next phase looks like for Ireland, and we will tomorrow. The Taoiseach has set out the criteria that will guide our decisions, and I genuinely believe we have every chance of success. But we've got to get the timing right. Moving too quickly will set us up for failure, and that failure would have real human consequences, devastating consequences that we're all too aware of, but also the social consequences of this going on longer, or indeed of us going backwards, which is also a possibility if we got it wrong. We will provide a clear sense of direction, but in the meantime, our collective objective remains to suppress this virus. We must do everything we can to stay safe and to protect each other. Despite some positive signs, it is too soon to say that we are safe from this disease. But it is in our power to keep ourselves safe and to keep others safe if we continue to stay at home, to wash our hands, to practice good respiratory hygiene, and to continue physical distancing. We have come this far. Let's not risk undoing it, and let's not risk going backwards. For our part, we continue to build our capacity across a number of areas to respond to COVID-19. And I'll now provide some updates on key areas. Our target for overall testing, as determined by the National Public Health Emergency Team chaired by our Chief Medical Officer, Dr. Tony Holohan, is 1,000 tests per week, operating on a 7-day-a-week basis for a minimum of 6 months from mid-May. The HSE has developed a roadmap as to how we can rapidly reach that capacity. It has the full and unequivocal support of my department. Significant progress has been made in a very short space of time to develop our testing capacity. The scale of this effort and the pace at which capacity is being developed cannot be understated. And I know there's been bumps in the road. I absolutely know that, and there has in every country in the world. But I want to thank the people who've worked so hard to get us to this point, to build these systems, because huge progress has now been made. The establishment of 48 community testing centres across the country and a steady supply chain of swabbing kits is in place. Significant laboratory capacity is being sourced nationally and internationally, and a range of supply chains for reagents and other materials have been sourced. A robust testing referral pathway for GPs has been put in place, and new IT systems have been developed and existing ones modified to ensure tracking of testing across the full process. 9 new contact tracing centres are in operation, and 1,700 people have been trained to date to support specialist teams in public health, occupational health and infection prevention and control. A major programme of testing is underway in long-term residential care facilities. 28,000 samples taken since the 18th of April in those facilities. This is a significant, complex and large-scale operation spanning a number of sectors and hundreds of providers. As we continue to build the capacity of our health services to deal with COVID-19, we'll also need to further plan how we will provide services for non-COVID-19 care over a protracted period. We know this is going to now be a protracted period, and people are going to get sick of things that are not COVID. So how do we care for them? And this is a challenge which all health services around the world are now grappling. At the end of March, the HSE entered into an arrangement with the private hospitals to use their capacity, including their ICU beds and their isolation facilities, in our response to COVID-19. The deal was on a cost-only basis, and all patients are to be treated as public for the duration of the crisis. I think it's important to remember the requirement for this additional capacity will remain with us. I've heard some people suggest that perhaps we didn't see that peak, we don't need the capacity now. Nonsense. Thankfully, and thanks to the sacrifices people have made, we have avoided so far the expected surge, so that currently there is a level of spare capacity in the entire system, both the public health service and the private health service. We will use this capacity, and particularly that of our private hospitals, to deal with the ongoing urgent work and the backlog of elective care needs, which has grown further over the last month. And we'll also use it to guard against the potential need for a COVID-19 surge in the future, a risk that should not be dismissed. As of today, we're using about 33% of their capacity, with some hospitals at 50%, and this is increasing and will increase further when we restart elective work when deemed safe to do so. Over 150 consultants have now signed up to the contract offered, and I understand more now intend to do so, once the recent agreement that the HSE can fund private rooms, if required, to provide public services is concluded this week. The arrangements provide for continuity of care for existing patients on an equal basis with public patients. The more consultants that sign up, the more services we will be able to provide to all members of the public. I want to thank all of our consultants currently providing excellent care in these challenging circumstances, and everybody in all professions and all workers right across the health service. I know our doctors would also want me to take this opportunity to remind everyone to contact your local health service if you are unwell. Don't feel you're a burden on the health service at this challenging time. If you are feeling ill, please do still come forward, because the risk of secondary deaths and secondary illnesses arising from this COVID pandemic is very real. So please do not wait if you need treatment. The number of clusters of COVID-19 in our residential facilities remains our area of greatest concern, and we're continuing with the significant measures already in place to protect both residents and staff. These measures include 18 response teams across the country, led by senior nursing support, infection prevention and control and public health input into preventing and managing clusters. We're prioritising the testing of staff and residents, as I've outlined. The regulator, HIQA, has published and is now assessing a new quality assurance regulatory framework for long-term residential healthcare settings, so that we have ongoing oversight, not anecdote, ongoing oversight into the response in each of these facilities, public, private and voluntary. We are currently looking at the public health measures, as you know, that are in place until the 5th of May. Our primary focus in that analysis will be to ensure that any action taken will not endanger the progress that we have made in suppressing this disease. Extreme vigilance will be needed, so that we'll not put our country at risk from future waves of this disease. Our society has already paid a significant price for the ground we have gained against this disease. As we move into the future, we must not lose that ground. The National Public Health Emergency Team is taking into account the expert advice of the World Health Organization, the European Centre for Disease Control and Prevention, and the European Commission in developing public health criteria, that's crucial, public health criteria, to guide our decisions. In order to move forward, we must have the capacity to measure the effects on the disease of any changes we might make, and to be able to do so very quickly. We can do this if our actions are underpinned by an efficient sampling, testing and contact tracing strategy and access to real-time epidemiological and clinical data. At every stage, we must watch the transmission of this disease. We must be confident that we have the sufficient capacity, and we're also fortunate, Cian Corla, that some countries are at a more advanced stage of this pandemic, that we can monitor that also. But the truth is, we cannot act unless we see that the disease remains suppressed. And achieving that, as I've said, is in the hands of each and every one of us. If we continue to make good progress, we can begin to restart our economy and, most importantly, our society. And we can look forward to a time where there are no new cases and no new tragic deaths. We will have a roadmap for the next phase, but we must continue to unite around a common purpose, to stay safe and to protect each other. Thank
you, Minister. We go firstly then to Fianna Fáil. Deputy Stephen Donnelly, please.
Gurmagat Ken Corla, and I'm going to be sharing my time. I'm going to take the first 5 minutes, and maybe the Minister and I could go back and forth with your permission. Ken Corla, I'd like to start by expressing my sympathies as well with the friends and families of the many women and men who have now died. It has come at an extraordinary cost so far. and it's a very difficult time for anyone who's trying to mourn a loved one or a lost friend at this time. I'd also like to acknowledge, without the extraordinary work of our healthcare professionals and indeed of every individual, every family in this country, that tragic number would be an awful lot higher, and an awful lot of good work has happened. Minister, I'd like to talk to you about getting the non-COVID healthcare going as quickly as possible. I'm giving the following case with permission of the family involved. Callum is a 5-year-old boy from Wicklow, lives very close to where you and I live. He's Down syndrome, and he has, unfortunately, many medical conditions associated with that. Here's what his mum Gillian told me earlier this week. Callum is my lovely boy. He started walking in 2019 after so much hard work. A year and a half ago, it was felt he had juvenile arthritis, and he was referred to rheumatology in Crumlin. Callum needs an MRI scan under sedation for this treatment. His scan minister is scheduled for next year, 2 years from when his doctor said he needed it. Callum is in pain. He's pre-verbal, so he can't tell us when he is in pain or where the pain is. His doctors need the MRI done so that they can limit the damage to his body. Callum's arthritis recently flared up, so he can't walk much anymore. He seems to have a lot of pain in his hips and his hands, and he's now on very strong painkillers. This week, his doctors in Crumlin thankfully decided to start the treatment, but to do so without the MRI and to try and provide what care they can. Callum needs physiotherapy twice a week. He has not had any for 6 weeks now. So that's his situation. Minister, my question is this. Why is the urgent therapeutic care in the community, including physiotherapy, not happening now? We have people going into work in supermarkets and other places without PPE who are public facing. It would seem the trained clinicians like physiotherapists with PPE should now be able to re-engage in urgent cases like Callum. So I'd like your thoughts on that. And secondly, Minister, to your point on the private hospitals, they are largely empty. We have diagnostic suites empty. We have operating theatres empty. We have entire clinical teams still not treating patients. When do you envisage, or do you envisage, that children like Callum will be able to get these scans and get these treatments through the private hospitals? If so, when do you think Callum, his mum Gillian, can expect to start seeing that kind of treatment? Thank you.
Well, thanks very much to Deputy Donnelly for raising these two important matters, both really linked to how do we provide for non-COVID healthcare. And I think you've really hit the nail on the head on a very important issue. We've all been preparing in this country, and indeed for in many countries, for the pandemic to take a certain course of action, to come to peak very high with huge human consequences in terms of deaths and very serious illness, and then hopefully to be on a downward trajectory. What we've now seen, thanks to the efforts of the Irish people, is that we haven't reached that awful surge. But we do now know that it's highly likely this virus is going to stay with us for a protracted period of time. And that does mean that we now need to really ask and act upon the questions that you're asking, Deputy Donnelly, in relation to how do you provide for non-COVID care alongside COVID care. And I don't want to use up your time and your colleagues' time, but there's a number of examples of that already, starting with community assessment hubs to try and keep COVID care in the community in the assessment hubs and non-COVID care in the regular GPs. Our physiotherapists, our speech and language therapists, our occupational therapists, so many of them have volunteered already to be redeployed and to help out with other areas of the health service. As you'll know, in our own constituency and nationally, people helping with contact tracing, people helping in community assessment hubs, people helping in testing centres. We are going to have to now make a call on what is the appropriate level of allocation to each of them to make sure other services can continue to operate. And the HSE will be finalising plans in relation to that. At our Medical Leaders Forum last week, chaired by the Chief Medical Officer and the Chief Clinical Officer in the HSE, the specific discussion was, what does a non-COVID care work stream look like? And in relation to the private hospitals, whilst I can't comment, as you'll know, on a specific case, I absolutely want to see these assets fully utilised for the benefit of public patients as well. I mean, the taxpayer is now paying for the use of these facilities. We have 19 of them around the country. We have diagnostic equipment in them. We will need to, and I did make this clear in my opening statement, we will need to keep capacity free because a surge could come, a second wave could come. But we can do more than we're doing now. So we've seen the numbers of cases of people being treated quite significantly increase, and we need to see it increase further. I'll look at the area of Callum's case and cases like that.
Minister, as you are aware, 90% of all deaths due to COVID are aged over 65. All my questions today will be COVID related. The Health Protection Surveillance Centre issued guidance for immediate implementation, saying that surgical masks should be worn by healthcare workers when providing care within 2 metres of a patient, irrespective of the COVID status. Minister, my call and my question to you is, do you agree that this should also be the case for home care workers who will see a number of different people every day, maybe up to 6? Most people receiving home care will be older or more likely to have an underlying health condition, and I've been contacted by very many home care workers who are concerned. So that's the first question. My second question, Minister, it isn't exactly your remit, but I believe you would certainly have influence in relation to this as it affects the care of those cocooning during COVID. While I appreciate we are coming into the summer months and there would not normally be a need for the fuel allowance at this time of the year, we are in exceptional times. Older people are being asked to cocoon and are therefore unable to leave their homes, which is having a knock-on effect of their fuel usage. They cannot walk outside their home, visit libraries, visit daycare centres. And I do appreciate the scheme has already been extended for 4 weeks, but it's due to expire on the 8th of May. And Minister, I'm wondering, could you use your influence that this could be extended again? Because when you're cocooning and you're not mobile, you can feel very, very cold. My next question is in relation to nursing homes. The situation in nursing homes and care homes remains in need of urgent attention. Almost 1/3 of nursing homes in Ireland have the COVID-19 virus, according to the Health Information and Quality Authority. The agreement between the HSE and unions for health staff to be diverted to private nursing homes where needed must be implemented urgently. Minister, I raised this 2 weeks ago. There still is issues around insurance indemnity. And I know it's been moving on, but it's dragging and it's causing a huge issue in relation to staffing. Minister, can I just, I appreciate testing has ramped up in nursing homes since last week, and as you stated, 28,000 samples taken to date. So there was 2 issues in nursing home, PPE and staffing. PPE, I have to acknowledge, has improved significantly in many nursing homes that I have spoken to, but they still have huge issues in relation to staffing. So my question is, Minister, you have tested 28,000 samples. It's imperative now that the test results are accelerated also, because when staff members have to isolate for 14 days while waiting for a test result, it's putting huge influence, it's putting huge pressure on the staffing numbers. And my final question, Minister, is in relation to the situation in Carrick, where asylum seekers are located. And my question is in relation to public health grounds. I believe, according to RTE News last night, there was 22 confirmed cases. The fear and anxiety expressed by the residents pleading to be removed from fear of catching the virus was intense. The locked gates was a terrible image, and also the worry, the anxiety that has caused for residents and businesses. So, Minister, could we have an update, please? Gaurav Mahagud.
Answer them all, maybe you might correspond.
So I'll send a written note on the last one. I imagine it may come up in conversations here anyway. Look, on the issue of home care workers PPE and nursing home PPE, Deputy Butler, over the last 7 days, 6.63 million items of PPE have been delivered across the health service. That's from the 23rd of April to the 29th of April. 54% of this volume was delivered to community residential facilities. That's a total of 1,767 individual deliveries. The full distribution is as follows. 54%, as I said, went there. 8% did go, though, to home care. And I had a very good meeting yesterday with HCCI, who represent many home care providers across the country. We've put in place a direct contact point for them with the HSE, a national director. And they've also brought forward some other suggestions that I'm working their way through in terms of their own provision. So yes, home care workers are now being provided 8% of our entire PPE. That's 497,384 items of PPE over the course of the last week went to home care. But we want to continue to do better and to do more on this. I think it's a fair point. On the fuel allowance, I'm going to resist speculating in departments that are beyond my remit, but I'll certainly pass on your comments to the Minister for Social Protection. In relation to nursing homes, look, you're right. I mean, there's a voluntary redeployment scheme in place. I've seen figures of over 200 HSE staff who have now been redeployed on various occasions to private nursing homes. That's good. It's well up from when I was last in this House, where I think the figure was about 61. So I welcome that. We have now reached an agreement with home care providers as well to redeploy, and that indemnity issue has now been ironed out, and there was an agreement reached about 48 hours ago, so I'd expect to see a benefit from that shortly. The funding scheme, which there was a bit of back and forth with Nursing Homes Ireland and my department, clarifications have been issued. The deadline is today, the 30th of April anyway, whenever that is. The deadline is now, so there's a surge of applications coming in. We're turning them around quite quickly within 24 to 48 hours. That will also help our nursing homes. And the testing. Yeah, you are right. I mean, there was an occasion where there were over 900 nursing home staff out awaiting various tests or with symptoms. What we're trying to do in testing people and getting the results back quickly is most of them will be negative and then we'll be able to go back to work. So yes, I think we can help nursing homes through the quick testing, through the directory deployment, through the home care worker scheme and through the funding scheme as well. Thank you. Sorry, did I?
The protocols that we had adopted stipulate there should be only 2 members from any party or group in the House at any one time. Please have regard to that. Deputy Niamh Smith.
Minister, firstly I'd like to pay my deepest sympathies to the families who have lost loved ones in this global pandemic, and the efforts of our health workers have been truly inspirational. Yet and all, Minister, we hear this morning on the Sean O'Rourke show the Labour Court deal for the nurses is behind schedule, and I'm hoping that that's something that you are dealing with, because as we know, these have been the inspirational men and women to the forefront of this pandemic. I want to thank our doctors and nurses and paramedics and home support workers and everyone on the front line who have been to the forefront of this. And of course, we've been blessed in Cavan Monaghan to have our Cavan General Hospital and Monaghan Hospital has been the backbone through this pandemic. Unfortunately, we've seen week-on-week increases, and of course Cavan, as of Wednesday of this week, had 634 cases with 388 cases in Monaghan. Cavan being one of the highest in the countries, Minister. There's 2 issues I want to raise with you today, and I'm so conscious of very little time to talk here today, but one being home testing. I have incidences where the referrals from home testing are getting lost in translation. An elderly couple in my area, the husband was taken to hospital and subsequently died, tested positive for COVID-19. His wife was at home, living alone in her home for 3 weeks, waiting on a test. And she had been referred, the home referral test had been made, and her daughter was living in her own constituency actually, and the son is somewhere else down the country, and she was in her home on her own for 3 weeks, and eventually her daughter had to come and put herself at risk, her mother at risk, her family at risk, and take her to her own home in Kildare, and she got tested within, I think, 3 hours of that transfer being made to a different CHO. So I would ask you, I think that's a problem in our own CHO one, the home referrals. And finally, just to say, cancer patients. I have a number of cancer patients. I'm thinking of one particular gentleman, a young man, a wife, 4 small kids, and waiting on an operation in St James's for a tumour. And he has been given no clarity on when that operation might happen, when. And I'm just wondering, are those operations that were scheduled before this happened continuing to being scheduled, or what the implications going to be? Thank you.
Minister, since this is an unorthodox time of social restrictions, my speaking opportunities in this chamber are rather limited these days. So I want to, at this outset, take the opportunity to express my immense gratitude to our heroic staff, especially our country's nurses and doctors. And I think when this pandemic is over, we really must remember them in many ways. And I think that will have to come up in the autumn, I think, when we're into a budgetary process. As our health staff risk life and limb to treat COVID-19 patients, we have Miss Gemma Doherty and her band of followers flaunting all laws on the street, giving cheek to our Gardaí, I think making a farce and being treasonous, I would say, to our frontline health staff. I hope that your colleague, the Minister for Justice, will ensure that the laws passed by this House will apply to all individuals, and that those who continue to flaunt these laws to court notoriety and attention on social media will be fully taken to task. Minister, a constituent of mine in Clare sent me this letter early in the week. It relates to her elderly husband, who is suffering from advanced cancer. He had been due to undergo surgery at the Bon Secours Barrington's Hospital in Limerick City on his private health insurance, but now the family have been told that due to COVID-19 they can't carry out this appointment, and now he's to join many others on the public waiting list, a waiting list that isn't moving at the moment. This is causing major stress to the family, and it's totally unacceptable. I think we would like some clarity on that, how people with private health insurance will be treated at this time, particularly those with life-threatening illnesses. At the outset of the COVID-19 pandemic, it was right for your department to strike a deal with 19 private hospitals to increase bed capacity. But now I think there needs to be a little bit of flexibility insofar as those waiting elective surgery is concerned. The word elective almost denotes flippancy and casualness, but for someone waiting a hip replacement, a colonoscopy or any type of colonoscopy. There's nothing flippant or casual about that. Elective surgery is absolutely essential. I think we need to get that backlog moving. Without an easing of the elective surgery restrictions, our health system will be hit with an unmanageable tsunami of cases when the COVID-19 pandemic shifts. I fear that this would disproportionately hit the UL group of hospitals, including Ennis in my own constituency. The waiting times in Limerick have risen by 10% this past year insofar as outpatient cases are concerned, and by 12.6% in Ennis in my own constituency. These waiting times are only set to worsen as the pandemic drags on, and I would very much like to know what actions you propose to take. Finally, Minister, I just wish to briefly draw your attention to the fact that administrative staff in our country's now very quiet private hospitals are also being laid off. I think this is fundamentally wrong, given that their places of employment are being very well paid by your department, very well paid with exchequer money. I'd ask, would you intervene in this, and would you consider using these staff to help with the contact tracing? Thank you, Concordia.
Deputy, I should point out to you, and I know you're a new deputy, so I wouldn't expect you to be totally familiar with this, but you've alluded to the actions of somebody outside the House who's not in a position to defend themselves, and whatever our feelings might be about the individual or their actions, it's not appropriate to refer to them here in the House. I'll just draw that to your attention. Something we might all have strong views on. But anyway, Deputy Louise O'Reilly, please. The floor is yours.
Indeed, Ceann Comhairle, I have very, very strong views, but sure, we could be here all day discussing them. Minister, there are a number of very pressing issues I want to address. I'm conscious that time is tight. I'm sharing time with Deputy Ward and Deputy Donnelly, 7, 4 and 4. So if we could maybe do ours within the 7 minutes, and if you can't then respond in writing, that's because I want to be respectful to my colleagues for their time, if that's all right. The first thing I want to say to you, Minister, is can you please today issue a directive to hospitals to ensure that nurses who went on strike, who fought hard for their pay increases, who deserve their pay increases, are going to get their pay increases? It is utterly ridiculous at this stage. Now, it's all very nice to stand in here and give them a round of applause, and but I've said this to you before. Nothing says I appreciate the work you do like decent pay and conditions. They fought hard for these pay increases, Minister, and I hope you'll be in a position to issue a directive today to say that they should be paid. I have two questions about nursing homes. The first one is to ask how many people have been seconded to the nursing home sector from the HSE to date. So you've given the figure of 200. I had a different figure that was given to me by the HSE, but I want to know what are the up-to-date figures, and I also want to know if you are planning on seconding a geriatrician or a geriatric consultant to work in any of the nursing homes. They've spoken to me. They say they're willing to do this work. Their expertise would be absolutely invaluable in this regard, and I think you should really look at that. The second relates to a decision to move patients from hospitals into nursing homes at the very, very start of this pandemic. So patients were moved from hospitals into nursing homes. Yesterday, on a conference call, I was told by the HSE that every patient that moved into the nursing home, they weren't going until they had 2 negative COVID tests. Can you confirm that that was the case from the very beginning? Because I tell you, I lost a relative in a nursing home. He died of COVID, but his family and the others in the nursing home are convinced that COVID came into their nursing home when the patients were transferred out initially. So Dr Houlihan last night appeared to row back a bit on that and suggest that maybe it wasn't all patients. So perhaps you could just confirm that for me, please. I have two questions on testing. Minister, I'm going to say this, and I've said it to you again. You really need to stop blaming people for the fact that they are, starting to, in some way, think about the relaxation. I think it was you and others in your government that put that thought into their head. There were mixed messages, and I know that work has been done to prevent that happening now, but there were mixed messages about the schools reopening. So I'm mindful of the view expressed by NEFIT, recorded in their minutes, that says all agree that testing and tracing is critical to tackling the virus spread. So we know that testing is important, we know that tracing is important. Can you state if the capacity is in place to move to disease surveillance testing, to move from disease surveillance testing, to actively testing in the community, so we can identify the total spread and transmission of COVID-19 and then contact trace every person who's involved? My second question is around the contact tracing app. Minister, I'm a big fan of the app. I want the app to work. I want there to be maximum buy-in, but let's be honest. you haven't exactly, you're not your department, your government haven't exactly covered yourselves in glory in relation to issues of data protection, particularly in relation to the public services card, but we need maximum buy-in. So can I ask that the data protection impact assessment be published well in advance, and that you allow organisations like the ICCL, like Digital Rights Ireland, and those who have an expertise and an interest in ensuring that this is done right, that you allow full input from these organisations. And my final question, Minister, relates to non-COVID mortality rates. Can I ask if there has been an increase in non-COVID related deaths compared to the same death rates for this period last year or other years? There is worry amongst patients' representative organisations that there may be significant health deterioration taking place and even additional fatalities, as data shows there is a significant reduction in people accessing health care. And can I finally say, Minister, I have two people very close to me who are at home cocooning. I would feel an awful lot more comfortable when they eventually can come out if all of the people around them were wearing masks. And can I ask, Minister, if you have a view on the wearing of masks in the community, and if you have a steady available supply of those masks so that we might all be able to comply. No, to go back to the Minister if we can. I had 7 minutes, please.
Councillor, how long have I got? Have I got 2 minutes? 3 minutes? Okay, thanks. So look, on a number of issues here, and I'm going to write to you on some just in the interest of time, as you asked me to. So in relation to the nursing home figures and how many staff have been redeployed, that's obviously a number that moves upwards and downwards. I saw a number of over 200. I know it was 61 last week, but I'll send you a breakdown by CHO. I do hope, and I don't want to build an expectation on this, but I did have a very good meeting on home care. I do hope that piece is also going to really help. There's a lot of work that they put into getting that agreement right, so I hope that will help as well. So I'll write to you in relation to that and on the issue of geriatrician. Sounds logical to me. I am conscious of the fact that we do have a geriatrician leading from a clinical point of view in this regard in the HSE, so I will seek her view on that. Look, on the issue of nurses' pay, yes, I've met the INMO on this as recently as maybe the last fortnight. My department have corresponded to the HSE clearly in relation to this matter. My understanding is 3,400 staff nurses have been appointed to this new scale in our public hospitals. That's up from around 700 in February, and around 220 have been appointed in our community healthcare organisations. But look, this is clear. There was an agreement in relation to this, and they need to be paid, and that needs to be processed. So we're very keen to see that processed very quickly. It is obviously noted that the contract's voluntary, doesn't require someone to complete an application process, but I want everyone who has applied to go on the payroll very, very quickly, and we have corresponded with the HSE, and I'll write to you on a timeline in that regard as well. On the transfers from nursing homes, from public hospitals or hospitals into the nursing home setting, and I sympathise with you in relation to your own loss. I'm aware of kind of the narrative or the question that people are asking in this regard. So there's a couple of things to say. I mean, the first thing is, let's remember, we were trying to move older and vulnerable people out of what was likely to be the surge setting or perhaps the danger zone in relation to acute hospitals to a safer place. So that was definitely the motive that everybody was engaging in. You're certainly not doing this, but I know there's a lot of people kind of saying, who brought the infection into the nursing homes? Was it staff coming in? Was it visitors coming in? Was it other patients? I think the reality is it's very hard to keep infection out of long-term residential care settings. I am assured by the HSE that testing guidelines and clinical assessment was carried out in all situations, but I'm going to confirm the question because I don't know the commitment that the HSE gave that there was 2 double negatives swabs. Was that carried out from what point in time? So I'll answer that in writing to you. And I would just make one point. Dr. Tony Houlihan does have a graph where he shows the time at which infection came into nursing homes versus the rest of the community. Certainly looks like an awful lot of those transfers would have happened long before that trend, and indeed that an incubation period would have passed. So that seems to be the general view. In relation to the issue of testing, yes, there is now a roadmap in relation to getting to 100,000 tests a week. That doesn't mean we'll be doing 100,000 tests a week. I'm conscious of not making the mistake other people have said in other jurisdictions in relation to this. There will be capacity to do 100,000 tests a week by the 3rd week of May. That's the 18th of May, outlined by the HSE. And I think we've sent your leader a briefing note on that this morning.
Mark Ward.
Thank you, Councillor Corley. And before I begin, Councillor Corley, I just want to take this opportunity to thank the people of Dublin Midwest for not only electing me once in the space of 3 months, but twice in the space of 3 months. And this is my first time addressing the House. And because of the limited time, as the last Deputy alluded to, I would like to, if the Minister could respond to my questions in writing to allow my colleague to come in immediately after me, I'd appreciate that. So the big announcement last week by the Minister of the 1.1 million for mental health supports might have grabbed a few headlines, but it will not deliver for frontline mental health services who are already struggling to provide a service pre-COVID-19. And this is particularly noticeable in youth mental health supports. As of December, and this is pre-COVID again, there was 2,327 children waiting for an appointment with the HSC's Child and Adolescent Mental Health Service, CAMHS. Over 100 of these kids have been waiting for 18 months and some have been waiting for more than 2 years. In my own area in Dublin Midwest, pre-COVID again, our local youth mental health service, Jigsaw, was moved from a 5-day comprehensive service based in Auchendalkin to a probable 1 or 2 day a week satellite service. And Jigsaw have seen a 420% increase in young people trying to access their services online during COVID. And why is this? Our young people are still unclear where they stand with their Leaving Cert. Young people are missing school, they're missing their friends, they're missing their sports. Some young people are witnessing and experiencing an increased level of domestic violence at home, and they have no safe place to go to. Young people have lost loved ones and have not been able to attend the funeral and grieve properly due to the current restrictions. I want to take this moment just to add my condolences to anybody that would have lost somebody in this challenging times. There are also many other examples, which I haven't got time to go into today, why our young people will need mental health services more than ever during and post-COVID-19. And these are some of the questions I'd like you to respond to me in correspondence, if you don't mind, Minister. So what additional resources are you directing to frontline youth and mental health services right now? What additional resources will you be directing to frontline mental health services post-COVID-19? How will the Minister reduce the waiting list for CAMHS? And will the Minister intervene and retain the service of Jigsaw service in Auchendalkin? And finally, it's not a question, our young people are really resourceful and we don't often give them the credit in which they deserve. Like, for example, young people across Dublin Midwest, and it's probably the same in your constituency as well, Minister, have been painting these positivity rocks. I don't know if you've seen them. They're really, really good. And they're words of encouragement for our fellow citizens in this time of tribulation. And today I just brought one to Leinster House, and I left it out in the plinth there for people to see. And it just states simply, we're in this together. So I think that's really, really good advice from our young people.
Thank you. Deputy Paul Donnelly.
This is my maiden speech. However, I will dispense with most of the usual thank yous because I do want to have as much time possible to outline my concerns for those in my community working and living in care settings. I do want to extend my condolences to everyone who's passed away in my constituency and throughout the country. I only wish to say, though, that I do heartfully thank everybody who has supported me through all the years where I've been campaigning in Dublin West. You all know who you are, and I hope some of them are listening here this evening. Minister, I've been deeply concerned by the emails and phone calls that I've received over the past few days from parents, carers and staff of private residential care homes and private care home providers. I was contacted by a home care worker who provides support for an elderly person the previous week, and I just found out that this person had sadly passed away from the coronavirus. The elderly person was ill, but the care worker wasn't told that it was the COVID-19. He did what every caring person would do, and he phoned his manager and he asked what would he do in those circumstances because it was the beginning of the day. And he was told to go and see all his clients that he had scheduled in that day, possibly putting them at risk. I was also contacted by two parents of very vulnerable children at high risk who said that the care worker coming into the home that day had been off for 2 weeks. They didn't know it was COVID-19 at that time because they were not informed by the company nor the worker that she had COVID-19, only that she was on sick leave. And they weren't contacted by the HSE either to inform them of the situation. Again, just yesterday I spoke to a very experienced and professional residential care worker, and he said staff haven't been told that they don't have to wear PPE even though it's on site and available. New staff have been taken on with absolutely no experience whatsoever. He also stated that contrary to normal best practice, there is no shadowing with an experienced and trained member of staff, and this is leading to poor hygiene and potentially poor outcomes for residents. He also said that they've been given directions by the HSE to wear equipment one day for it to change the following day. And they're confused, and I suppose there's a lot of frustration in relation to trying to care for the residents in very difficult circumstances. In another care home, the HSE visited the centre and only spoke to the management, and he didn't consult with a single member of staff. And I think that's really important that those people are consulted and spoken to, because they're the ones who are working with people on the ground. last week I spoke to a family member of a home care assistant, and I think it really summed it up really well. She self-isolates as best as she can between shifts because she's too tired, too angry, too furious and too upset to put into words how she's feeling. She hasn't hugged her kids in weeks and they miss her, but they're proud of her. She's risking so much more than me, more than you and more than she should have to. Minister, what can you say to these frontline workers we have, which we all clap every week, who have had many big announcements, but by the looks of them, from what I'm hearing anecdotally from people and people directly, is that we've had poor delivery on some of those announcements. And the question I suppose I would put you is, can you confirm that they all now have PPE equipment that they need? Can you confirm that they have the staff that they and the residents need for their proper care? Can you confirm that the companies who victimise workers who speak out will be sanctioned? Can you confirm that the families availing of home care packages will feel safe in the knowledge that home care workers coming into their homes and not putting their children and elderly relatives at risk? And can you acknowledge that the private care system cannot cope with a pandemic and that we need to move into a one-tier system of care for our most vulnerable citizens?
Deputy, do you want the Minister to respond, because the clock is ticking?
Yeah, just I suppose, could I ask if any of the questions that you can't answer, would you please write them to me? Just one final one then, Minister. Could I also ask if you consider designating specialist sports services for children with ASD as essential workers? Parents are under severe pressure at home with children with ASD and they're in real difficulties.
Thank you, Deputy Donnelly. Minister,
look, just in the interest of fairness, because I'm conscious people at home watch these, they hear questions being put out on the floor. They don't get the letter I sent to you in the post. So, I mean, we have to divide up the time here. I came here to answer questions. If I don't know the answer, I'll write to you. But we have to be able to at least have some time to answer the questions.
Very briefly,
yeah, on the issue. So, if we could divide the time properly going forward on the issue of Jigsaw, just Deputy Ward, I'm actually due to meet them on Thursday, and I'll come back to you after that. Mental health is a key priority, particularly youth mental health, and I'll come back to you directly. We want to support Jigsaw in what they're doing. Deputy Donnelly, on the issue of ASD, I think you're right. I mean, there is a reality now that there's a lot of kids who've been out of school and maybe haven't been even able to access normal health supports either. We've got to look at what an intervention for them will look like over the summer months. I'm working on that across government. Look, I want to acknowledge the huge work done by people in home care settings and in residential care settings. I think if there is any complaint that anybody has, there are obviously regulatory authorities to go to. HICWA have started inspections and visits this week in line with standards. I think that will be important. And the issue of PPE, I've put on the record of the House the increase, Cahirlock, in that regard, and also on staffing, and I'll write to you on the rest. Thank you.
On Deputy Hayden, I believe you're sharing your time with Deputy O'Donnell. That's right.
Yeah, that's right, Chairman. I just knocked my phone off there.
You have 10 minutes.
Yes, so I'm
and answers.
I'm sharing my time with Deputy Kieran O'Donnell there as well. Minister, thank you very much. I want to use the short bit of time I have and commend you on the work and those of your officials on the ongoing work that's ongoing. I want to take this short bit of time to maybe raise the concern of nursing homes in the Kildare and Laois area. And that have been raised with me, and points I would have made to you already as well. Directly is to raise some of the concerns that there are in nursing homes. Obviously there's huge pressure there that you're aware of, that they're under. There's great work and dedication of the staff in what are very difficult times, and from speaking to nursing home owners and managers in my constituency, I know their main issues are financial support, staffing support and recognition for their staff. The COVID-19 temporary assistance payment scheme has generated some confusion because there is a short period of time, and I know everybody's working under real pressure, both your officials in putting schemes in place, the NTPF and the rest, and then the nursing homes. But I think we have to have due consideration, and I'd ask your officials to bear that in mind, the pressure that nursing homes are under in trying to manage the issues they have, as well as the forms and stuff that they have to fill out at the minute. There's that stress, you know, at a time where nursing home staff and management are pretty exhausted right now, as well as everyone else is, and working at the pin of their collars. While the main form, which is due in today, I have had requests that for Form B and C for the NTPF to be simplified in as much as possible and to be reviewed to ensure they cover the actual costs of the crisis for nursing homes. The costs of private transitional winter initiative and delayed discharge beds also needs to be addressed, as well as the empty beds, to ensure the future viability, because there's the initial crisis here now, but there also is the challenge that we want to make sure we have a viable operating nursing home sector in 3 to 6 months' time. And I know nursing home providers are worried about the future for their residents and for their staff. Their hard-working, caring and dedicated staff also need to be recognised and rewarded, and I know in time we'd like a way of doing that. Many are sacrificing time with their own families to live and ensure the highest standards. Many of these workers aren't on the highest of wages, yet the hours they're doing are pushing them into the higher tax bracket, and I know this comes into the area of finance as well, but I would be very supportive of us looking at some measures to make sure that those people who are working those big hours are actually, if there's some way that we can make sure the higher rate of tax isn't, or there's some rebate or something could be given back, just to give that due recognition there, because they really are our front line for the nursing home sector, caring for our most vulnerable loved ones in those settings, and they're some of the points just to feed back from the nursing home sectors that I'm dealing with. Thanks.
Time. Look, I mean, the staffing is a major issue, Deputy Hayden, and I know you've raised this with me. There are 3 ways we're trying to assist nursing homes, well, 4 really. 1, through the direct redeployment of HSE staff. Secondly, through an agreement that we've reached with home care providers to allow home care staff to be redeployed. That agreement just reached in recent days. Thirdly, to ensure a faster turnaround time for testing for staff, and a priority for that, so that the many staff who don't have COVID-19 can get the all clear, if you like, and go back into the workplace. And fourthly, the funding scheme that you referenced. I'm very open to extending the timeline for that funding scheme. Didn't want to do that too early though, because I do want people to get the applications in and pay the money out, and we're paying the money out within 24 to 48 hours. I'm meeting with Nursing Homes Ireland twice a week now, and we've provided a lot of clarifications that they asked for in terms of the scheme. We obviously have to have checks and balances, but I'll continue to keep that under review. I've no doubt that there are broader funding issues and policy issues in relation to nursing home care that we'll look at maybe in, let's call it, peacetime. But for the moment, I think the funding scheme, up to €72 million worth of funding there for private nursing homes over a 3-month period, is substantial. I'm eager that it's not bureaucratic, and I think we made some improvements in that regard in recent days.
Thanks very much. I want to thank the Minister. Minister, I just want to raise a few points. I've roughly 5 minutes. I'd expect that I'll use probably about 2 or 3, and I'd ask you to respond. This is a public health crisis, but we have to strike a balance. And what I really want, I suppose, to ask the Minister is, the Taoiseach today, in his presentation to the House, spoke about 5 conditions he's going to look at in terms of easing restrictions: progress of the disease, healthcare capacity and resilience, testing, tracing and contact and tracing, ability to shield and care for vulnerable groups, and then the risk of secondary morbidity due to and mortality. I just want to ask you, Minister, where do you see those? You made reference to about COVID being with us for a long time. How long do you expect that COVID will be a daily part of people's lives and in terms of the business sector? I also want to ask you to clarify the whole area around elective work. We are getting a lot of people in Limerick and North Tip where in many cases we're being told that some of the elective work that needs to happen, it's veering into the acute area. Can they be, where does that fall into the whole issue in terms of the private hospitals? What way can that capacity be used? You made reference to you must preserve that capacity. The over 70s and the cocooning. I have elderly parents. They don't like to be called elderly, but they are. We haven't seen them in over a month. We are very similar to many other people. The question is, Minister, in terms of lifting the restrictions, are you going to look at ways around very much undermining with public health, where these people outside the 2-kilometre limit can be, people don't have to actually come into contact with them, but they can physically see them to check up on them? And finally, Minister, 2 final questions. Testing and tracing. University of Limerick are willing to provide a testing and a lab on site for the community. Are you looking at regional testing? And my view on it at this stage, we must get back to some sense of normality with the business sector, daily lives. Contact tracing and testing are the key ones. We must get up to that 100,000 limit as quickly as possible, because at the end of the day, people's lives are being impacted. Will you look at it on a regional basis? And one of the issues that's coming up finally is the reverse of that. Students, third-level students, will certainly be finishing, in many cases, their online exams. Many of those will no longer be going abroad in terms of finding jobs. And there's a worry that in many cases they'll be, we'll say, renting houses or whatever in terms of social distancing. Is that being looked at? Is that being considered? So, Minister, if you could address those points very quickly. Thank you.
Thanks very much. Thanks, Deputy O'Donnell. Look, I suppose I'm pleased we're in a position in the Dáil where we could be asking now about when are you going to recommence elective work, because if you look at the modelling as of today, had we not lowered the R rate, the reproductive rate for this virus, from just over 2 to where it is now, we would have seen 2,200 people in our ICUs today. And of course, we'd be in a very dire situation. Now, and that's not to take away from the very difficult and sad situation that 103 people are in our ICUs today and the worry that their families have for their well-being, and we think of them. But you are right. I mean, thanks to the massive work of the Irish people, frontline staff and public health experts, we have a situation whereby we do currently have vacant capacity in our public hospitals and significant vacant capacity in private hospitals that we are now paying for the next number of months. What we need to do, though, is we need to get the balance right. We need to recommence some non-elective COVID work, because you can die and get sick of things that are not COVID. We don't want a situation where we come through COVID as best we can as a country to find that there's a very, very sad situation with secondary deaths from COVID, though we know that there will be an element of that. But it is that balance right. We have to keep a certain amount of vacant capacity, a certain amount of critical care capacity, isolation capacity, in case a second wave does come. But you're right, we had a meeting with medical leaders from across the country, indeed including a leading doctor from Limerick on Saturday, about how you try and have the non-COVID work stream alongside the COVID work stream, and we'll be using our private hospitals for that as well. Look, on the issue of the National Public Health Emergency Team, the roadmap, the timelines, I'm not going to speculate on the record of this House today when I know the plan will be published tomorrow, other than to say this. It will be grounded in public health, because it has to be. It's a public health emergency. The moment we decide to take any other tack other than public health is the moment we begin to lose the progress that has been hard won, hard gained at huge expense from the people. But I do hope we'll be able to provide a degree of certainty tomorrow in an uncertain world. You know, if we can get the virus into this condition, what does that mean we might be able to do in society again? But also get all of us thinking. Government, yeah. The Oireachtas, yeah. But also sports clubs, schools, businesses. What does this mean for me? And how might I have to adapt how I run my life or my business or my organisation? So I think there'll be a lot to discuss on that. On the over 70s, I'm very conscious of this. I'm very conscious that over 70 is not old. Very conscious that there's a lot of people over the age of 70 that are very active. And I'm also very conscious that they see it as a bit condescending when politicians are telling them stay at home. We're doing it on the grounds of public health advice and nothing else. I'm conscious that there's the health and well-being of them. It's not for me to predict what NPHET will do or indeed become NPHET, but I hope it's an area, and I know it's an area they're continuing to monitor very closely. Of course, people can travel and visit relatives for care needs, and I just want to say that. I want to say that as well. On the issue of Limerick and a lab, I'd be very happy to take those details and talk to the HSE about that. We do now have, I think it's 27 labs across the country. We're very eager to find any more capacity that we possibly can. Thank you.
Smith, on behalf of the Green Party, you have 10 minutes. Questions and answers.
Ceann Comhairle, or Cathaoirleach. Last week, Minister, I asked if we could find a mechanism to pay our radiography students. And this was in the same way you found a mechanism to pay our nursing students, given that they're putting themselves and their families at risk by working. And you told me that you would ask your department to come forward with proposals for other students usefully working in the health service and whom we need. I hope to bottom that out before we meet here again. So we meet here again. And I'm here for an answer, not for me, but for the radiography students who are wondering when are they going to get paid. Also last week, I asked you about extending the power to prescribe to optometrists. And you told me you would speak to your department and you would revert to me directly. I don't want this speech to be too accusatory, but you know, there's a pattern to this, right? The COVID queries system, which replaces Dáil questions. Obviously, we can't put down Dáil questions, so I'm putting down these COVID queries, and I haven't had an answer. Queries that I put down last week, we've passed by the deadline. I've had answers from all the other departments, but not from your department. So clearly there's something not working. Maybe other deputies could say whether that's happened with them as well. I haven't had answers on the COVID queries from health, and I shouldn't have to bring them in here and put them all to you. Also last week you said you would update this House on progress with the mobile app, which is obviously key to being able to relax restrictions. Information that I've had about this mobile app has been very scarce, and I had to read in the newspaper this week that it's going to be a decentralised app instead of a centralised app. You suggested that I bring this up with the HSE, with the weekly meeting with the health spokespeople, which I did with Deputy Shorthole here, and I was promised by an HSE director that they would supply me with a copy of the specification, so I'm looking forward to getting that. Ireland is one. Ireland, if we're going to go for a decentralised model, I welcome that, because there are only 2 countries in Europe, I understand, that are insisting that their health authorities should be able to see the data that's provided by these contact tracing apps. And there is a real risk if we tell people that we're going to spy on them, or that the health authorities are going to see all their data, that they won't buy into this and they won't use the contact tracing app. You've mentioned that it's important, Minister, you've said that it's important that we're all in this together and that we pool our resources and work together. And yet we're not having an open discussion about the app. I'm asking questions, I'm asking basic things about the specification, and I'm not being supplied with any information. So I'm just going to boil down my question to this. Will you commit that before you launch the app that you will publish the data protection impact assessment, and also that you will publish the technical specifications? And that's before launch. The lockdown measures are due to expire on the 5th of May, as I understand it, and we're just a few days before that, and there is very little information about what's going to happen. It's very hard for people to plan in that situation. And I listened to what you're saying today about that. We don't know what the criteria are going to be to relax the restrictions. We don't know what different phases there are. We don't know what the